My name is Amelia. I'm a student physical therapist under the direction of Dr. Clausen. Today I was working with a patient. Her name's Bonnie. She's a 26-year-old mother. She came into the clinic reporting lower back pain. And so after the examination, we pinpointed the area of pain to be her right lower back around the L5 level right next to her spine. She has lots of pain and tenderness in that area. So moving forward with therapy today, I would like to use ultrasound. As I do believe she's in like a non-inflammatory chronic state. The ultrasound would be good for her today because I would like to reduce her pain and encourage vasodilation. Some contraindications to look for would be just making sure that she's not currently pregnant. I also want to avoid using the ultrasound over the spine, staying away from the spinal cord. I would also ask to make sure that she's doesn't have cancer and she hasn't had any like back surgeries in that area. All right, Bonnie. So I know your low back is pretty painful and tender. With therapy today, I would like to try something. It's called ultrasound. It's basically I'll just take the ultrasound head. This is what it looks like, and I'll put lotion on it, and then I'll just be moving it around the area of pain on your back. What it will do is it will use sound waves to transfer heat into the muscles of your back. It should help relieve your pain, and it will help bring blood and fluid to that area and just kind of hopefully break up that chronic pain that you're in. Does that sound okay?
Yeah.
Okay, so what I'll have you do is just lay down on your stomach. Would you like a pillow underneath your hips?
Yeah, that would be nice.
Okay. And then, are you comfortable right there where you are?
Yeah.
Okay, we'll be here for about 10 minutes, so.
Okay.
Okay. Is it alright if I lift up your shirt a little bit just to expose your lower back so I can use ultrasound?
Yeah.
And then I'll take this towel and I'll just gonna tuck it into the waistband of your pants so I don't get lotion on your pants. Is that okay?
Okay.
Okay, Bonnie. Before I get started with the ultrasound, I just have a couple questions for you. Some things that ultrasounds aren't good for. If you're currently pregnant, if you have cancer, if you've had like a cemented surgery where they put like a rod or like anything in your spine in that area. Do you have any of those things? Are you pregnant or anything? Okay. Also, I just want to make sure that you have good circulation and sensation around your back, so I'm just going to touch the small of your back and just make sure that you can feel it, okay?
Okay.
Can you feel this?
Mm-hmm.
Can this?
Mm-hmm.
And that?
Yep.
Okay, good. And with the Blanche test, your circulation comes back, so it looks great. I think we're okay to proceed with the ultrasound. Okay, so I'm turning on the ultrasound machine, and I'm going to put a lotion on the head. But first, I want to set it up, so I want to turn it on to sound, which is the ultrasound aspect of the machine. Since it's in your lower back and you have quite a few muscles back there, I'm going to leave it on 1 megahertz, which means that it will just get into the deeper back muscles. I'm going to leave it on continuous because I want to use heat. I want to heat up those tissues, which is a continuous current will do that. The intensity, I'm going to bump it up to 1.5. It's the lowest range, and then if the patient tolerates it well moving forward with therapy, we can always bump it up. I'm going to do it for about 7 minutes. So Bonnie, before I put this on, I just want to let you know it should feel comfortable. You should not feel pain or burning or anything. It will warm up the muscles of your back, but if it gets too hot, just let me know and we can turn it off, or I can lower the intensity. But does that sound okay?
Yep.
The lotion might be a little bit cold at the beginning. Okay, I have the lotion on the head of the ultrasound machine, and I'm just going to put it on the patient.
It's so cold.
Yes, sorry. It's going to be a little cold. I'm going to keep the area that I moved the ultrasound around to about 2 or 3 times the size of the head of the ultrasound. So I'm going to move the intensity up to 1.5, moving the ultrasound in slow circles. I have the time set to 7 minutes, and we'll get started. Does that feel okay, Bonnie?
Mm-hmm.
Okay. Okay, it's been about 7 minutes. How are you feeling?
Good.
Okay, I'm gonna stop the ultrasound. I'm gonna clean off this real fast. Was there any pain or anything that bothered you during the ultrasound?
No.
Okay, got all the lotion off your back. Your skin looks great still. Your circulation looks okay. Does the sensation feel okay?
Mm-hmm.
Okay, perfect. Well, that's ultrasound. We'll just go ahead and move forward with therapy for
Cool.
today.